Hello, my name is Dr. Scott Cohen from Shenango County Health Department. I'll be talking with you today about novel H1N1, aka swine flu. This is just a brief overview. If you have questions, you can call us at 607 337 1660. This was originally adapted from a presentation given at a local school district on November 3rd. Some of the information may have changed since then. Please check the web for more detail at cdc.gov as well. Question number one, what is novel H1N1? Well, it's really just the flu. It is a novel strain of the flu that hasn't been around much in the past 20 years. It was seen in the 1970s and the 1950s, which is why we're concerned for people especially under age 24, since they've really never been exposed to it before. What's really different about this? It's really just the media. As you can see, it's really been very concerning in the media. In terms of, unfortunately, sometimes scaring the public, in one sense saying, wow, there's a 15-year-old who unfortunately passed away from novel H1N1, which also happens, by the way, with the regular flu. But then on the other hand saying, wow, the H1N1 flu vaccine is very scary and don't get it, which of course is definitely not true. It's the same flu vaccine, just a different strain. What do you do, of course, if you have the flu? The flu being either novel H1N1 or the seasonal flu, and realize, of course, there are hundreds of people out there with influenza right now. The vast majority of those people with influenza actually have H1N1 and not the regular seasonal flu, since the regular seasonal flu is not out all that much. Some of these flu symptoms include fever, although not everyone has a fever with it, a cough, sore throat, runny nose or congestion, body aches, headaches, chills, fatigue. Occasionally, people, especially children, will have diarrhea or vomiting. What should I do if I get sick, though? Stay at home. Really, you should avoid exposing others except to get medical care. And when you're at a healthcare provider's office, please wear a mask. All the healthcare providers I'm aware of are offering masks in their office. Realize that most people with either H1N1 influenza or seasonal influenza do not need medical care. Really, the only people who need medical care are those who get very ill with it, or those who are at very high risk, i.e. people with severe asthma or heart disease. These are some of the people who can be considered higher risk for influenza, whether it's seasonal flu or H1N1. Children younger than 5, but especially children younger than 2 years old. People age 65 or older we think are at higher risk with seasonal flu, but not necessarily so with H1N1, and the reason being that probably most people over age 65 have been exposed to this virus at least twice. Pregnant women are especially high risk and really need to get the H1N1 vaccine. Also, other folks who might be at higher risk, those with cancer or blood disorders, including sickle cell disease, people with chronic lung disease, including asthma or COPD, those with diabetes, heart disease, kidney disorders, neurologic disorders, chronic neurological disorders such as Parkinson's, those with liver disorders or neuromuscular disorders such as muscular dystrophy or multiple sclerosis. Some of the reasons you really need to start talking to your doctor in children, if there's fast breathing or trouble breathing or bluer skin color, children who just aren't drinking enough fluids to stay hydrated, or they're not waking up or not interacting well, the truly lethargic child in this case, or if they're being so irritable that the child just doesn't want to be held. Also, if there are flu-like symptoms that just improve or even go away and then all of a sudden return with a fever and worsening cough or even shortness of breath, those folks need to need to be talked to with their doctor. Also, if there's a fever with a rash. In adults, if there's difficulty breathing, shortness of breath, chest pain or abdominal pain, sudden dizziness, confusion, or in anyone if there's just severe or persistent vomiting such that they can't keep things down. What should you do when you're sick? Please try to stay away from others as much as possible to keep from making them sick. If you must leave home, for example, to get medical care, wear a face mask. Cover coughs and sneezes with a tissue or in the crook of your arm. Wash your hands often to keep from spreading flu to others. And CDC has some information about taking care of sick people at home on its website, cdc.gov. What can I do to protect myself from getting sick? Well, this season there is a seasonal flu vaccine to protect against the seasonal flu virus, which really isn't even around yet, as well as an H1N1 vaccine to protect against the 2009 H1N1 influenza virus. sometimes also called the swine flu. A flu vaccine is really the first and most important step in protecting against flu infection. There are also everyday actions that can help prevent the spread of germs that cause respiratory illnesses like the flu. You really can just take some of these simple everyday steps to protect your health. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue in the trash after you use it. Wash your hands often with soap and water. If soap and water are not available, use an alcohol-based rub. Avoid touching your eyes, nose, and mouth because germs are easily spread this way from your hands where you've touched things into what we call mucous membranes of your eyes, nose, and mouth. Try to avoid close contact with sick people, although that can be difficult, and we don't want to make people feel ostracized. If you're sick with a flu-like illness, CDC recommends that you stay home for at least 24 hours after your fever is gone. This is very important. This is, of course, except to get medical care for other necessities. Your fever also should be gone without the use of Tylenol, Motrin, or other fever-reducing medicines for 24 hours. And please try to keep away from others as much as possible to keep from making them sick. The H1N1 vaccine comes in two major forms, although there are different brands for different age groups, as well as different brands within age groups. The injectable contains inactivated particles. They're dead. You cannot get the flu virus from this. The advantages are that it's not a live virus, but disadvantages are that it's an injection, and we might notice a slower immunity onset and possibly lower immunity titer than the nasal vaccine, which is live. The nasal vaccine, which is called live attenuated or weakened virus, the advantages are it's extremely easy and quick to administer. It's faster and probably even better immunity. It's not an injection, which is great with kids. Disadvantages are that there's some community fears of live weakened virus, and it's only given to people ages 2 through 49 years. So one of the biggest questions that we're asked daily, and one of the reasons we're producing this video, is where is the vaccine? Everyone really wants it, although there are some folks who are still somewhat fearful of it. The production and distribution delays have been out there for a while. The CDC has been telling us, as well as the public, about it. The vaccine is trickling in larger and larger amounts, but unfortunately probably won't be available until mid-November or even later. It might not be available in large doses until a month or two even after that. The vaccine is being distributed to health departments, hospital, doctors' offices, and even some pharmacies. Everyone has been asked by the state health department to be patient. Target groups will be vaccinated as it becomes available. The highest risk target groups are pregnant women, household contacts, and caregivers for children younger than age 6 months, healthcare and emergency medical services personnel. One, because healthcare and EMS folks can transmit it to people before they realize they're truly sick, and also because we need folks to take care of those who are ill, and that's going to be difficult if all the EMS and healthcare workers are sick. And also all people from 6 months to 24 years of age meet the high-risk criteria. Persons aged 25 to 64 years who have health conditions associated with a higher risk of medical complications from the flu include those that we talked about before: cancer, blood disorders, diabetes, heart disease, kidney disorders, liver disorders, and these other items on the list. Those folks are also in the target population for the novel H1N1 vaccine. At this point in the lecture, we stopped for questions. If there are any questions, please feel free to call us at 607-337-1660 or at the numbers listed in this next slide. Thank you for your attention.